Hey y'all, constipation is one of the most common questions we get from Shotsy users. And it makes sense. You're on a new medication, you might be going to the bathroom less, you might be having more trouble straining, or you're maybe less comfortable going to the bathroom. And you're gonna start to wonder, is this the medication? Is this normal? If it's normal, what should I do about it? In this video, I'm gonna cover 4 things about constipation that are gonna make this easier for you to handle. So in this video, I'm going to cover 4 things about constipation. I'm going to cover why it happens with GLP-1 medications. I'm going to talk about what the manufacturers of these medications have to say about it. I'm going to talk about what we actually see in Shotsy with our hundreds of thousands of users, what they report about it and how they handle it. And then I'm going to talk about some simple things that you can do to help make this easier for you, or when to decide whether you should talk to your doctor and whether this isn't normal, whether you may actually have a specific problem that needs to be looked at. So as usual, this is not medical advice. I'm going to give you basic information. Hey guys, I'm Eric. I'm the CSO for Shotsy. Let's talk about this. So why do GLP-1 medications cause constipation? The truth is there probably isn't a single reason. GLP-1 medications have the effect of slowing down your gastrointestinal system. Food stays in your stomach longer. Food moves through your system slower. That alone could constipate you, make you have fewer bowel movements just because of that. But also, it's not quite that simple. People tend to eat less. If they're full, they tend to drink less water and be less hydrated. So the fact is that these medicines actually have multiple things going on that can lead to why you're constipated. But let's start to probably what is the most number one reason people get constipated, and that's because you are simply eating less. You're putting in less food. That little bit of food is moving through your system slower, it's staying in your system longer, so you're having fewer bowel movements, and that's the definition of constipation. Now, if you're just slower and having fewer but healthy bowel movements, well, that might be fine. The real problem happens is when you're not going enough, when you're starting to get uncomfortable, or when your stool's getting really hard so it makes it uncomfortable to go, you're straining or you're just having trouble going. That's when constipation becomes a thing that actually needs some form of attention. But why is this? Besides just slowing your gut down? Well, you're eating less food, so there's less stuff going through. You're probably drinking less fluids, so you're less hydrated. The nature of your diet is changing. You may be getting less fiber. You may be getting less fat and protein. So in addition to these medicines just slowing your gut down, the fact that you're eating less probably has a lot to do with why people get constipated. All that said, despite this being common, disruptive bowel habits are not normal. If you're not going to the bathroom enough, if you're having trouble going to the bathroom, if you're struggling, if there's a lot of discomfort, if you have a lot of cramping, these things aren't necessarily normal, and you may need to talk to your healthcare provider about exactly what's going on with you and find ways to ease it up. So while going to the bathroom less may be part of GLP-1 medication, having uncomfortable constipation should not be. Okay, so what do the manufacturers of these drugs say? Well, constipation is a recognized and well-documented side effect across all families of GLP-1 therapy. For Tirzepatide, the drug in Zepbound and Mounjaro, this constipation was very well documented in clinical trials. About 11 to 17% of patients documented having constipation, compared to only 5% in placebo. It's well recognized, it's well talked about it, and it's just out there to know that a good number of people on these drugs are likely to get some constipation. The same is true for the drugs behind Ozempic, Wegovy, and Saxenda. All these drugs have recognized constipation as a side effect. But here's something key to note. While all these manufacturers recognize that this happens, there's actually very little guidance direct from them on how to manage it. So oftentimes managing constipation comes down to managing basic principles as opposed to expecting, if I'm on this drug, there's something very specific. Now that said, what often they do say is they do relate it to dosing. And so one of the manufacturer-specific remediations that you'll hear is to titrate your dose up slower if you start to have side effects, which just makes sense. If a drug is causing something to go on, ease into that change, allow your body to adapt, as opposed to making big changes that could cause severe constipation. For example, the Wegovy prescribing information explicitly states to adjust your dose slowly to avoid gastrointestinal side effects. This is a very important signal from them. But remember, if this isn't a race, dose escalation isn't a race. You want long-term results on these medications to make you healthier and to feel better. And so going a little bit more slowly and avoiding side effects probably helps you stay on the medication longer and get better long-term results than rushing and fighting your way through side effects, or fighting your way through side effects and then trying to treat those side effects with lots of other things that could also mess you up. So what do we see in Shotsy? Well, we looked at the constipation data in Shotsy, and first of all, there's a bit of a limitation. Most people that use Shotsy don't log their side effects. As a scientist, I wish they would, because I think they would find the data very useful, but at the same time, most don't. So we actually have a fairly small number, about 1% of Shotsy users actually log side effects. So out of the millions of people that have downloaded this app, we don't have a massive data set on this, but we absolutely have enough people in the data set that what we see is statistically significant. So exactly what we see, we saw about 15,000 Shotsy users had logged constipation, and they had logged it on more than 10 days. When they've logged it routinely, they logged it lasting, or they were logging over a period of about 132 days. This is pretty consistent actually with what we see with diarrhea, although diarrhea is slightly less. Constipation getting logged an average of 10 times by these people, with diarrhea about an average of 8 times. So very persistent, very common, lots of people dealing with this. That long 132-day duration is actually very consistent with what scientific studies have shown about GLP-1 side effects, namely that gastrointestinal side effects tend to last longer. Things like migraine, sleep, other things like that come and go. But the gastrointestinal side effects of a GLP-1 can last a long time. But again, this makes complete sense given that the way this drug works is it changes how long food stays in your stomach and your system and how fast that food moves through your stomach and system. So you would expect it to have gastrointestinal side effects. Okay, so what can you actually do to manage constipation? First, let's start with hydration. You're eating less, you're drinking less. And the most important thing you can do to keep your gut going is to drink a lot of fluids, healthy fluids, water, light electrolytes if you need to, but basically hydrate a lot. It will really help things move, make you feel a lot better. Plus you won't be as dehydrated, which will also make you feel a lot better. So hydration is probably the first and best thing you can do to work on your constipation issues. The second thing you can do is look at your fiber intake. When people stop eating as much, they often tend to change what they're eating a little bit. And so I think it's real important to pay attention to macronutrients when you're on GLP-1. Do not drop your fiber intake. Eat fresh fruits and vegetables, eat healthy whole grains, eat good sources of fiber. Again, especially soluble fiber, which is actually going to allow the material to move through your system more naturally, reduce constipation, make you feel better. So don't lay off the fiber when you're on your GLP-1. Definitely stick with it. The third thing you can do is move. Motility is about your gut, but it's also about your body. The more you're up and moving around, the less sedentary you are. The less you're sitting and laying down, the more your body is just naturally going to move things through your digestive system. You're also going to burn more calories. You're going to keep your energy balance in better shape between your food intake and your exercise, and you're going to feel better. So one of the most important things to do is to get up and move and keep moving soon as those constipation symptoms start, or to prevent those symptoms from starting. The fourth thing is definitely pay attention to where you are with your dose. If you're having a little constipation and you're doing well, but then you have a couple of bad episodes, absolutely check your log, look at what you're doing and seeing if you did a recent dose increase. So definitely watch your dosing, because as I said, the one clue manufacturers give about these side effects like constipation is that quick dose changes can absolutely make them worse. So watch your dose. If you've done a large dose and you get more constipation, talk to your healthcare provider. Consider backing that dose down a little bit and going a little more slow. Again, it's not a race. So what happens when fiber, exercise, and hydration aren't enough? Well, you may need some help. There are polyethylene glycol-based laxatives you can get over the counter. There's fiber supplements. I'm not going to recommend any specifically here. Talk to your pharmacist or to your healthcare professional, but you may need something to help you with this. But if you start doing that, because those things are also problematic, I would also suggest consider where you are with your dose. It's one thing to use a laxative to help you get through an event where your dose went up, or you just had a severe incidence, isolated incident of constipation. But using laxatives chronically can actually be very problematic. So that's something I would try to avoid. Okay, lastly, let's talk about when you should actually be concerned. I've been talking through this whole video about what I consider mild constipation. You're not going quite as much, you're having a little discomfort going. That's not the same as you haven't gone in a long time. That's not the same as severe abdominal pain. That's not the same as you've actually vomited and haven't gone to the bathroom in a long time. Any gastric disruption that feels like you're actually quite sick or getting sick needs medical attention promptly. I'm not saying run to the emergency room unless you're really sick, but what I am saying is if you get stomach issues, severe stomach issues on your GLP-1, absolutely talk to a healthcare professional sooner rather than later, and just make sure you're on the right track because, these drugs are expensive, you're putting a lot of work into it, and you don't want to mess things up because of a side effect that you could manage better if you had the right information. Okay, the bottom line is these drugs do cause some gastrointestinal side effects, and constipation is probably the most common one. It's absolutely manageable. Hydrate, eat more fiber, get up and move, use over-the-counter laxatives occasionally if you need to, but it's not something that you should allow to get severe or live with severe problems. Don't assume constipation is just something you have to live with if you're on these medications. You really don't. Anyway, I hope this was helpful. Subscribe for more videos like this and take care of yourself. Cheers.